I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have two amazing guests with us today. I can't wait for you to hear what's going on with them. So Dr. Jamie Valis and Dr. Kristin Compton. So the first thing I have to start with is, Kristin, you've got to tell us about your hat.
So I'm a born and raised Kentucky girl, and today is the Kentucky Oaks. And so this is my tribute to the Kentucky Oaks. I couldn't be in Kentucky for the race day, but I am wearing my hat anyway. And it is pink because Oaks Day is to help support breast cancer awareness. So I am also promoting breast cancer awareness with my pink hat today.
I love that. So you're on a roll. So let's talk about Dr. Kristin Compton. So what do you do, Kristin?
So I am a dentist by training, but I am the VP of Clinical Operations for Kramer Davis Health. And so in that role, I design and develop all of the operational policies and procedures and patient flow and all the day-to-day operations of how the clinic will function.
Okay, so let's go back and talk about Kramer Davis Health. So what is Kramer Davis Health?
So Kramer Davis Health we are a startup company. We're a transdisciplinary clinic for adults with intellectual and developmental disabilities. And we have a whole host of disciplines that we support. So medicine, dentistry, psychiatry, therapy services, so physical therapy, speech therapy, and occupational therapy. And then we also bring in specialists, all to try to do a really good transdisciplinary holistic care for adults with intellectual and developmental disabilities.
That's wonderful. Now, Jamie, tell us about yourself, what you do in this field, and your connection to Kramer Davis Health.
Great. Thanks so much, Craig, for having us. So I'm the Vice President of Training and Education at Kramer Davis. And so my responsibilities are really to make sure that our staff are trained and ready to provide the best possible care for our patients with intellectual and developmental disabilities. And then also we'll be creating educational materials directly for our families and our patients eventually. So one of our first initiatives is starting the Kramer Davis Learning Institute, which will house and be a repository for a lot of the training that already exists and that we'll be creating as well.
So it's a clinic to provide health care, dental care, really, like you said, transdisciplinary, multidisciplinary care for people with intellectual and developmental disabilities. But it sounds like it's a little more than that when you're talking about the Kramer Davis Learning Institute. Yeah, so tell me more about the Learning Institute, what types of training you're developing currently, what types of training you want to add to it, how you're going to deliver that. Let's talk about that.
Of course, yeah. So as we know, patients with intellectual and developmental disabilities face a lot of challenges when it comes to healthcare. And one of the biggest things that they face is providers, doctors, dentists that aren't trained to care for patients with intellectual and developmental disabilities.
Were you trained in dental school?
I was trained.
You were?
I
wow,
was.
That's unusual.
So I went to the University of Louisville School of Dentistry, and Dr. Henry Hood, who is one of our founders, actually taught a course there. So that's how I got started initially and was first introduced to working with adults with intellectual and developmental disabilities. And then I went on to do a fellowship in developmental dentistry, also with Dr. Hood and Dr. Matt Holder. I'm one of the lucky few.
She's one of the unicorns. So we know that about 81% of medical students graduate without any training related to IDD. And those that do receive training receive less than an hour. So Kristin is definitely that unicorn that's out there that we are looking to find and hire for Kramer Davis.
I was one of those who didn't have any of that training. So yes, I think it's great what you're doing. So tell me more. I'm sorry I interrupted.
Yeah, no, you're good. The Kramer Kramer Davis Learning Institute will be a robust integrated healthcare training system for all healthcare professionals. So initially, we're starting with a background of 6 core courses related to IDD healthcare, and that's really going to be the foundation. So what is IDD? What is neurodevelopmental disability? What are the 5 essential concepts? We'll be talking about health equity and social determinants of health. We'll talk about legal issues, which is a major area that gets very complicated, accessibility, communication, and then clinical considerations. And we're working with our partners at Intellectability to create these courses.
Yeah, and we're very honored and very proud to be working with Kramer Davis Health in the creation of these courses. And these courses are going to be made available primarily to train your staff, but for other uses as well, too, right? Do you want to elaborate on those?
Yeah. So ideally, these training courses are going to be available free access to those that really feel like they need it the most. So not only our staff can we ensure that they're trained to the level of excellence that we want them through these courses, but we're going to make them available to our friends at AADMD and especially medical students and other healthcare students because they're the future. And our goal is to kind of reimagine healthcare and do that through training. So one of our partners is also AADMD and the Niche Project.
Which is the American Academy of Developmental Medicine and Dentistry, which is where we're coming to you from today in recording of this episode. And the organization has a very heavy focus on providing training and education and moving that platform forward to make sure that every clinician has some level of training and understanding about how to provide healthcare to people with intellectual and developmental disabilities. So you're working with AADMD, you're going to make the courses available through AADMD, and you mentioned Niche.
So that formerly known as NCIDM, but that is the project to infuse healthcare information and education about the IDD population into medical schools. So we're going to make sure that students that are part of that project have access to this curriculum for free. We know that our patients face challenges every day when it comes to their health. And so the last thing that we want to do is create another burden or another barrier for them to have good health care or great health care. And so by making sure that our providers have access to that training for free is a no-brainer for us. We want to make sure that we are changing the landscape through education.
So I know that you have some other training things in mind, and one of them is probably related to dental care. So I'm going to ask Kristin to talk about the importance and the value of training dentists about this.
One of the things that we've noticed as we've grown and learned from running and operating the Lee Specialty Clinic is that dentistry is often very siloed from healthcare. And one of the things that we want to do is make sure that dental is included as part of overall health, right? So we know there's been a lot of research come out over the last several years about the oral systemic health connections. We currently run an AEGD program, which is Advanced Education in General Dentistry through the Lee Specialty Clinic. And so just really encouraging dentists to start thinking outside the box and really thinking across disciplines and how they can incorporate oral health into other areas and vice versa. So one of the other things that we do that's really unique at our clinic is we have what we call a clinical protocol meeting. That meeting is a transdisciplinary meeting where we talk about really challenging cases, and we sit around the table as different disciplines, and we not only learn from one another, but we can take that knowledge and we can apply it to each of these cases and help these patients to have much better health care. And I think that that's one of the beautiful things about what we do is that transdisciplinary approach really makes the health care that the patient gets better, but it also makes us as clinicians better.
So you mentioned the Lee Specialty Clinic, and that's kind of the precursor to Kramer Davis Health. So, and you've been involved with the Lee Specialty Clinic prior to this as well, right? So Lee Specialty Clinic is in Louisville, Kentucky.
Yes.
Right? I've had the pleasure of visiting it and seeing the amazing work that you all have been doing there for quite some time. And then, so now it's evolved into a little bit different model, but kind of similar, I guess?
Yeah, so the clinical model is the same as the Lee Specialty Clinic. The financial model is a little bit different, but our goal is ultimately to take all the things that we've learned from running the Lee Specialty Clinic over the last 14 years and take that and build upon it and make it even better. So, I think the things that we do at Lee Specialty Clinic are already incredible, so I can't wait to see how we make it even better than what it is, right?
So I have a hard question for you, okay?
I love hard questions.
Okay. So when we talk about improving health equity for people with intellectual and developmental disabilities, there's a lot of focus on community-based supports and services. And when we think about that in terms of healthcare, there are a number of people who really think that the healthcare should be all community-based as well, and that people with intellectual and developmental disabilities shouldn't necessarily have to go to some specialty clinic to get healthcare.
That is a hard question.
I told you. I prepped you for that.
So I don't disagree with that, right? I would love to see all of our adults with intellectual and developmental disabilities be able to go to any clinic that I could go to and receive great care, right? We've already talked about the lack of education. That's a huge piece, right? If a provider's not comfortable, maybe they just don't know how to provide great care, right? And so I think in order for us to get to that point, which would be an amazing goal, right? But in order for us to get there, we're going to have to do a lot of steps towards education. We also need to really talk with payers. So on the health insurance side about how can we get providers to be reimbursed in a way that makes them want to embrace this population into their practices. And then I think until we get to that point, right, where are these patients going to get care? And so that's why we exist, right?
So that's really my perspective as well too. The ultimate goal that I talk about all the time is that anyone with any level of disability should be able to present to any doctor's office, to any emergency department, and receive at least a basic level of competent and compassionate health care. That does not exist right now. Now, there's a lot of people doing a lot of work to move in that direction, but we certainly need specialty clinics, I think, not just until that happens, but think about it this way too. I'm a family physician. I do primary care. So if I was asked to do heart surgery on someone, it would be a horrible outcome, and because I don't have the training or the education or the experience. So we need to first provide training if we want someone to be able to provide that level of care, and it does take time to train the workforce. But secondly, as a family physician, I referred people to specialists all the time. If I had a stomach condition, I would refer them to a gastroenterologist, or a person had a stomach condition or a heart condition to a cardiologist, or so on and so forth. So we already have a model of specialty health care. And sometimes people have more, complex needs that do require that real interdisciplinary, multidisciplinary approach by clinicians that have a lot of experience. So I think the end goal is both, that everyone should be able to go and get health care anywhere, but we have a need for specialty clinics as well too. So
yeah, absolutely.
All right. Hope that helps make the question not quite as hard. I didn't mean to put you on the spot on that.
No, you're good. That's great.
So please add.
Yeah, I think just to add to that, like the healthcare system in general is broken, but for our patients and families, it's even more broken. They have lost trust completely in the healthcare system, and a lot of our job is to rebuild that trust when they walk in the doors. And we do that through that patient-centered care. We do that by taking the time that's necessary for every patient to feel comfortable, making the adjustments, making the adaptations to their care plan to ensure that they're comfortable with what's happening. And those adjustments range from music that's playing in the dental wing to a weighted blanket, to dimmable lights, to accessible tables, those type of things really make sure that our patients start to rebuild that trust so that they can have that excellence in healthcare. Also thinking about communication is probably one of the biggest barriers that our patients face. And that takes experience. As Kristin said before, that meeting that we have where we kind of bring cases to the table, complex cases, that's a training opportunity. So we can train as much as we want in the classroom or on e-learning, but once people have that experience, that's really where they're learning how to care for these patients, and we're learning on a daily basis. And that's the same for communication. A lot of our patients don't communicate in the traditional ways that we communicate.
But they still definitely communicate.
Oh, there's a lot. There's even probably more communication. The problem is we just sometimes don't have a knowledge of how to understand that. And that may be represented in a behavior that another provider may say is, aggressive or not ideal for the clinic. But for us, it's more of that mystery of what is causing that behavior and how can we unpack it and solve that problem for the patient so that they're in better comfort and that they can live a healthier, happier life.
Yeah, that's fantastic. Yeah. So Kramer Davis Health is going to be opening a clinic soon, unless it already opened by the time this podcast airs, so be aware. But where is it going to be?
Our first clinic after our lead specialty clinic, which is in Louisville, will be in Nashville, and we are planning to open in September. We're very excited about that. We have an amazing clinic facility there that is just about finished, the construction build. We are in the process of hiring an amazing team and working through all the other logistics to make sure that we're ready to open our doors to these patients.
That's exciting. I know the work that you all have done at Lee Specialty Clinic and the thousands and thousands of lives that have been impacted in a positive way. And now you're going to be able to do that in Tennessee and
beyond.
Maybe some other areas, right?
Yeah, we don't necessarily have that blueprint yet of where we'll be next, but the game plan is to definitely expand beyond Nashville, beyond Tennessee, and we're excited to kind of see where that takes us.
Well, that's super exciting, and I can't wait to see the opening of that. I actually I'm going to do my best to be there and maybe record a few episodes and get some updates on what's happening. If I can't be there, I'm certainly going to visit soon and talk to some other people that are part of the clinic. Because it really is a fantastic project. And I know you too, and I know other people that are involved in this. And it's one of the things that's really exciting is it's people with the right mindset, the right heart, and the desire to really have an impact on the lives of other people, people with intellectual and developmental disabilities, to reduce unnecessary suffering from people that aren't getting diagnosed from things or, being told, well, this behavior is just due to their intellectual disability rather than looking for some underlying cause. And those are the things that you guys have spent your lives working in and career in, and there's no doubt it's going to have an impact.
Yeah, and I think that's probably one of the most special things for us as employees of Kramer Davis is it really is founded with people that have the heart and passion for this and decades of experience. So Dr. Henry Hood and Dr. Matt Holder are our founders. They founded Lee Specialty Clinic. And really, at the end of the day, those two will do anything to put a patient first. And that's really the core value that sets us apart, I think, from anything else.
Yeah, I think we're really a community of people who are also trying to collaborate with like-minded communities who all have the interest of the IDD population at heart. And my favorite saying that I always tell people is, if you bring me people with a heart, we can teach them how to do this. And I think, that's our goal, right? Is to surround ourselves and to build, an employee base and community partners of people who all have a heart for this population, and then, see where we can take it.
It's hard not to step into the doors of Lee Specialty Clinic and hopefully our first Kramer Davis Clinic in Nashville and not completely be overwhelmed with passion for this type of work. Our patients are just incredible. The stories that we could sit here and tell for hours are just incredible. These patients are really the core of what we do.
Well, we're going to do that on some future episodes for sure. So if people want to learn more about Kramer Davis Health, how can they find out about it?
So hopefully by the time this airs, we will have a website. But right now we're just on LinkedIn. And yeah, we'll be hopefully launching our website in June.
Well, I'm thankful to be a part of it and the part that we can play in it. I'm really thankful for the two of you taking the time to be on this podcast today and to share these stories. And I'm exceptionally thankful for the work that you both do in this field. Thank you so much.
Thank you, Craig.
Thank you for having us.